And try to resist me. Okay. So I'm able to push him down with one arm. Really, a good hip strength is I should almost be able to push down with both hands and really get my body weight into it. So what we're going to do now is we're going to do a little bit of dry needling to his glute medius muscle, which is going to improve that, and then we'll check his strength after. The way dry needling works is we insert what's called a monofilament needle. It's a very thin, solid needle, like similar to an acupuncture needle. And we're actually going into the muscle tissue in an area where, in his case, there's weakness. In some cases, I might have someone who has pain down their leg, pain into their back, and this is where I may be focusing my attention because of the pain referral. So we just use that. What happens is the muscle will twitch when I hit a knot in the muscle, and it can be a little uncomfortable to slightly painful, but it's usually just a real split second. And then we move around a little bit and release as much as we can, and then we'll retest the strength, and it should be significantly better than what it was just a minute ago. Work about midway through, and I'm just going to palpate it a little bit until I feel a tight spot, until he tells me he feels that and feel that. Okay. All right, so we keep the skin really tight, push this little tube against the skin, and then tap the top of the needle where I grab onto it. So the insertion does not hurt. Most people think, oh, I don't like getting shots, but it really doesn't hurt to go into the skin. The only pain is when we get into the muscle and it causes that twitch. So you may see me kind of pulling it out and going back in. What I'm doing is the needle is staying in his body, but just in the skin layer. So when I come out, I can change my direction to do what's called fanning that muscle. So I'm trying to release as much in that muscle as I can with the one needle. There we go. Feel that one?
I felt it.
All right?
Mm-hmm.
Try to hold it right there. All right, hold it really strong. There we go.
Can't believe that.
Can you tell?
That's crazy.